Japan is getting older fast. Imagine a country where nearly 1 out of every 3 people is over the age of 65. That is not a prediction. That is modern Japan. Streets are quieter, classrooms are smaller, and nursing homes are fuller than ever. At the same time, fewer young people are entering the workforce, especially jobs in elder care. This creates a question that feels urgent, emotional, and deeply human. Who will take care of the elderly when there are not enough hands to help? Japan's answer may surprise American audiences. Instead of waiting for a demographic miracle, Japan turned to technology, more specifically robots. Not the cold, metallic machines from sci-fi movies, but gentle. Purpose-built helpers designed to lift, listen, remind, and even comfort. In Japan, robots are becoming caregivers, assistants, companions, and in some cases, emotional support partners for older adults. To understand why this works in Japan, you first need to understand the scale of the problem. Japan has one of the longest life expectancies in the world. At the same time, birth rates have been falling for decades. Fewer children mean fewer caregivers, fewer nurses, and fewer family members able to provide full-time support. In the United States, families often rely on assisted living facilities, home health aides, or relatives. Japan uses those options too, but the gap between need and available care workers keeps growing. This is where robotics enters the picture, not as a replacement for human care, but as a force multiplier. Robots in Japanese elder care are designed to reduce physical strain, fill staffing shortages, and improve quality of life. Think of them as extra hands and steady companions, not replacements for love or empathy. One of the most common uses of robots in Japanese nursing homes is physical assistance. Caregiving is physically demanding, lifting patients, helping them stand, moving them from beds to wheelchairs. All of this takes a toll on the human body. In the United States, caregiver injuries are a major issue. Japan faced the same challenge and responded with robotic lifting systems and wearable exoskeletons. These robotic suits help caregivers lift patients safely without straining their backs. The caregiver still provides the care, but the robot provides the strength. This simple shift has reduced workplace injuries and allowed older caregivers to stay in the workforce longer. It is not flashy, but it is practical, and it works. Then there are mobility robots. Some look like advanced walkers with smart sensors. Others resemble small robotic chairs that help seniors stand up, sit down, or move across a room safely. Falls are one of the biggest risks for older adults, both in Japan and the United States. These robots monitor balance, detect instability, and provide support at exactly the right moment. But Japan did not stop at physical care. One of the most fascinating areas is social and emotional support. Loneliness is a silent epidemic among older adults, especially those living alone. In Japan, many seniors outlive their spouses and have children who live far away or work long hours. Sound familiar to American audiences? The emotional gap is real, and robots are being used to help fill it. One famous example is Paro, a robotic baby seal. It does not look like a machine. It looks soft, warm, and expressive. Paro responds to touch, recognizes voices, and reacts with gentle movements and sounds. Studies in Japan have shown that interacting with Paro can reduce stress, lower blood pressure, and improve mood among elderly patients, including those with dementia. At first, Americans often react skeptically to this idea. Can a robot really provide comfort? But when you watch an elderly patient smile, talk and relax while holding Paro, the question changes. It is no longer about whether the robot is real. It is about whether the comfort is real. And for many seniors, it absolutely is. Another category of care robots focuses on cognitive support. These robots remind seniors to take medication, attend appointments, drink water, or perform daily exercises. In the United States, missed medications are a major cause of hospital readmissions among older adults. Japan uses robots to reduce that risk. Some of these robots speak in friendly voices, use simple language, and adjust their tone based on the user's mood. They are programmed to feel less like alarms and more like helpful companions. Instead of a cold beep reminding you to take a pill, You hear a gentle voice saying, "It is time for your afternoon medication." That small change makes a big difference. Japan is also using AI-powered monitoring robots that quietly watch over seniors, especially those living alone. These systems track movement patterns, sleep habits, and daily routines. If something unusual happens, such as a fall or long period of inactivity, caregivers or family members are alerted immediately. For American families worried about aging parents living independently, this model is incredibly relevant. Privacy is a major concern, especially for US audiences. Japan addresses this by designing robots that collect only essential data and focus on safety rather than surveillance. Cameras are often avoided in favor of motion sensors and pressure detectors. The goal is dignity first, technology second. One reason robots are more accepted in Japan than in the United States is cultural. Japan has a long history of viewing robots positively, often as helpers rather than threats. From early industrial automation to popular media, robots are seen as partners. In the US, robots are sometimes framed as job stealers or cold machines. Japan's cultural mindset makes adoption smoother. That said, Japan does not ignore the emotional complexity of elder care. Robots are not meant to replace human relationships. Instead, they free up human caregivers to spend more time on emotional connection. When a robot handles routine reminders or heavy lifting, nurses and aides can focus on conversation, empathy, and personal attention. This hybrid model is something the United States is starting to explore as well. As the American population ages, especially the baby boomer generation, the demand for elder care will skyrocket. Japan's experience offers a real-world case study, not a futuristic fantasy. Cost is another important factor. High-quality elder care is expensive in both Japan and the US. Robotics can reduce long-term costs by preventing injuries, reducing hospital visits, and allowing seniors to remain independent longer. For healthcare systems under financial pressure, this matters. In Japan, the government actively supports robotics research for elder care. Public funding, private partnerships, and policy incentives all play a role. Nursing homes receive support to test and adopt new technologies. This coordinated approach helps innovation move from labs to living rooms. American viewers may wonder if this level of automation feels impersonal. But when you listen to Japanese seniors talk about their robotic helpers, the tone is often surprisingly warm. Many describe the robots as reliable, patient, and non-judgmental. A robot never gets tired of repeating instructions. It never rushes. It never gets frustrated. For some seniors, that consistency is comforting. There are limitations, of course. Robots cannot fully understand complex emotions. They cannot replace family visits or human touch. Japan is clear about this. Robots are tools, not substitutes for human love. But in a society facing unprecedented aging, tools matter. One powerful example comes from dementia care. Dementia patients often struggle with anxiety, confusion, and agitation. Certain robots are programmed to provide calming interactions, play familiar music, or guide patients through simple routines. This reduces stress for both patients and caregivers. In the United States, dementia care is one of the most emotionally and financially challenging areas of healthcare. Japan's robotic solutions offer insights that American hospitals and assisted living facilities are beginning to study closely. Another area gaining attention is robot-assisted rehabilitation. Seniors recovering from strokes or injuries use robotic systems to practice movements repeatedly and safely. These systems provide real-time feedback and adjust difficulty automatically. Therapists oversee the process, but robots enable longer, more consistent sessions. What makes Japan's approach especially compelling is that it is not about flashy innovation. It is about solving everyday problems, helping someone stand up, reminding someone to eat, keeping someone company. These are small moments, but they add up to dignity and independence. For an American audience, the lesson is not that robots should replace caregivers. The lesson is that smart technology can support a system under strain. As labor shortages grow and healthcare costs rise, ignoring these tools may become impossible. Japan is essentially living in the future that many countries will face soon. Its success and struggles offer a preview. Robots alone are not the solution, but neither is nostalgia for a time when families could do everything themselves. Modern aging requires modern answers. As technology continues to evolve, robots are becoming more intuitive, more affordable, and more human-centered. Voices sound more natural. Movements feel smoother. Interfaces become simpler. The line between machine and assistant continues to blur. For seniors, what matters is not whether a helper is human or robotic. What matters is feeling safe, respected, and supported. Japan's experience shows that when robots are designed with empathy and purpose, they can play a meaningful role in elder care. For Americans watching this unfold, the question is no longer if robots will enter elder care, but how thoughtfully they will be used. Japan offers a blueprint not to copy blindly, but to learn from. Aging is universal. Dignity should be too. In the end, Japan's story is not really about robots. It is about adapting to reality with creativity and compassion. When society changes, care must change with it. And sometimes, the helping hand that makes all the difference happens to be made of circuits, sensors, and a surprisingly gentle touch.